Hello, my name is Anthony. I'm a BSN1 nursing student. Here's my ID. And I'll be performing a head, eyes, ear, nose, and throat assessment and a lung and abdomen assessment. Um, right now, this is my patient that will be here for today. His name is Devin. You please show me your video release form. This is his video release form. Do I have consent to videotape you?
Yes, you do.
Okay. Now I'm gonna do a quick 360 scan the room. Can you be sure to hit the floor too? All right. Hello, Devin. I'm going to be your nurse today, and today I'm doing the head, eye, ear, nose, and throat assessment, and a lung and abdomen assessment. So, can you please tell me your name and date of birth for me, please?
Yes, my name is Devin Harrison. My date of birth is 8/24/1999.
Okay, cool. So, can you please tell me, do you have any medical conditions? Have you ever had asthma, COPD before?
Yes, I've had asthma in the past before.
In the past? What about COPD?
No.
Okay, okay. What I'll be doing now, as I'm starting my assessment, I'll be performing hand hygiene, donning some aseptic gloves, ensuring patient privacy, and walking through the EMR, looking through the patient's charts. So right now, I'm pretty much going to assess your mental status. From what I know, I see that you alert. You're looking at me. I know that you're alert because you're pretty much focused on me. You're pretty much sitting upright. Can you please tell me how you feeling today? What's your mood like?
I'm feeling pretty good today. Pretty happy.
Pretty happy.
Yeah, nice day outside. So.
Nice day outside. So I'm assessing a few other things about your mental status. Can you please tell me what am I here for? What am I here for?
I'm basically just here just for a checkup.
Basically for a checkup. So I'm pretty much doing an assessment already. Can you please tell me the time of day it is?
Yes, it is currently.
What you think? What time it is? I'm sorry.
No, you're fine. It's currently 1:30 p.m.
Well, 1:30. Where are you located right now?
At the University of Toledo.
Okay. The exact location, like we know what the building is and everything.
Oh yes, Ottawa West, fourth floor.
Okay. Okay. So, based off of his mental assessment, he's pretty alert. He knows pretty much what his surrounding is and everything for right now. His speech, I know that your speech is pretty clear and it's articulate. Now, you can set the phone to the side.
Yes.
So, now I'm going to be assessing your head. So I see that. Your eyes are symmetrical. Your head is normal cephalic. It's midline with the rest of your body. I see that the back of your eyes are aligned with the top of your ears. Your nose is midline and it's a symmetry with the rest of your body. And then now I'm gonna do a few tests with your facial movement test. So do me a favor and smile for me. Frown, puff out your cheeks, and raise your eyebrows. Both of them. Okay. So all right. So all of his features are symmetrical, and they all of his movements were symmetrical. They all aligned to move with his body. Now I'll be inspecting the contour and the skin of your face. I know that your skin is pretty clear. It's beige brown tone, melanated. As I said before, your face is pretty clear. I know that you have a small primary lesion in the shape of a freckle. There's no drainage on it, so it's good. Now I'll be inspecting your head and your hair. I note that it is a wavy texture at the top of your head. The condition is pretty clean, and your hair is evenly distributed. Distributed. I'm sorry. And then now I'll be performing. I'll be inspecting your eyes. So can you do me a favor and grab the bottom of your eyelids and pull it down for me?
Yes.
Based off noting it, I noticed that his sclera is white. He has minimal red veining patterns on it. and his conjunctiva is clear and there's no drainage coming from it. So that's good. Now I'll be performing the Perla test, which is Perla stands for pupils are equal to round and reactive to light and accommodation. So right now, can you do me a favor and sit up for me? So with this test, what I'm gonna be doing is I'm gonna be measuring. I'm gonna line this up to the side of your eyes right here. And from what I know that your pupils are 5 millimeters in diameter, so that's good. Next, what I'll be doing, I'll be performing a indirect and direct light test. So what I'm gonna be doing now is I'm gonna be shining a light at your eye. You can just kind of just focus on like my chest area above my shoulder,
Okay.
and I'm gonna be shining a light in your eye to test for a constriction of your pupils, so you can just look right over my shoulder for me.
Gotcha.
Okay, and now I'm gonna do the other side. Okay, for what that was, with the indirect, I noticed that his pupils constricted from each side. You can kind of show it to me. So I noticed that his pupils constricted with each side, and then now I'll be doing the indirect, the light test. So with this one, I'm gonna be shining light to one side and then looking at your other eye. Okay, that's good. And then now shining light to your left eye, your right eye. So now this is the indirect one, which each one I tested his pupils. When I shine a light into his left eye, his right eye constricted, and then when I shine a light to his right eye, his left eye, left pupil constricted. And I'll be performing the ear test. So from the side, I note that his lobules are intact from his tragus and lobule area. It's intact. There isn't any drainage. I'm going to just take a look in the side right here. There isn't any drainage coming out from it, from his lobules and his tragus point. So that's good. Now I'll be performing the nose test. And then right now, can you do me a favor and look up for me real quick? And so I'll be looking under here for any redness. And I know there aren't any redness up in your nose. I do know that there's a secondary lesion in the form of a nose piercing. I know there aren't any drainage coming from there, so that's good. Now I'll be performing the mouth and throat test. So you do a favor, open up your mouth for me. So now looking at your mouth, I know that your tongue is pretty intact. It's pink and it's moist. There isn't any cracks or anything coming from your tongue. I'm looking at your throat area. From the throat area, I note that, in the tonsils, I do know that there isn't any, it's moist, it isn't any drainage coming there. I would grade your tonsils as a +1. Now can you do me a favor, lift up your tongue for me? And so now looking under the tongue for both sides in the sublingual area, I know that it's moist, there isn't any extra drainage coming from it, and it's intact. And then looking on this cheek side, in this buccal mucosa area, it's intact and it's pink and it's moist. So that's all good. Oh yeah, back to the eyes. One of the things that I forgot to do the Cardinals positioning test. And what this is I'll be looking for, I'll be positioning this in different areas. So give me a favor, look at the top of the pen.
Yes.
I'm gonna be positioning this in different areas. And what I'm looking for is symmetrical movement with both of the eyes. And I know that it wasn't any nystagmus, so that's good. One thing I forgot about the Perla test, I forgot the test for accommodation. So can you do me a favor and look up here at the top of this while I point this in? Okay, that's good. So his eyes were symmetrically caved in with the top of the pen. His pupils constricted and his eyes converged in. Now I will be performing the anterior and posterior abdominal assessment. So what I'm gonna be doing now is I'm just gonna be noting you're pretty upright. You're not using any extra intercostal muscles to breathe in, or any accessory muscles. So which are things such as your diaphragm or your sternocleidomastoid. Um, your oxygen source is pretty much room air, so you're not using any extra exterior breathing to use. So now, what I'm gonna have you do is can you kind of sit up kind of closer to the end of the chair for me, please? What I'll be doing now is can you do me a favor and take you, actually, before I move to that, I forgot about the neck assessment. So now, I'll be performing neck assessment. Can you do me a favor, lift your chin up?
Yeah.
So, now what I'll be doing is I'm inspecting his neck. I notice there isn't any lesions or any marks on his neck. It's pretty clear. Do I have permission to palpate?
Yes, you do.
So now we can palpate this trachea area. Do you feel any pain or tenderness while I'm doing this?
No.
Okay. Any pain or tenderness?
No.
Okay. Good. So after inspecting and palpating his neck, he knows that there wasn't any pain or tenderness, and his neck is pretty clear. Next, what I'll be doing is, as I said before, your oxygen source is room air. So now, what I'll be doing is, you do me a favor, and do I permit you to take your shirt off for me so I'll be able to go through the abdominal assessment. Okay, so actually, next, can you actually do me a favor and move up onto the bed? Yeah. I'm gonna have you go up to the bed for me. Alright, you pretty much just turn around. Yeah, you turn to the side, because I'll be able to see it from the side. So what I'll be doing now is I'll be taking 10 different positions from his back. So he come from this way. Give me. Alright, so with each movement I do, can you do me a favor and take a deep breath from me?
Mm-hmm.
I'll be starting at the apex of his lungs. Do me a favor, breathe down for me. Okay. Okay, breathe down for me. Okay, breathe down for me. Alright, breathe down for me. Okay, breathe down for me. Alright. Again. Okay, again. Okay, breathe in for me. Alright, breathe in again for me. Alright. Based off the posterior thorax assessment, all of it, I know that there weren't any signs of wheezing, rhonchi, lung sounds. They are pretty clear. Now I'll be doing the anterior, so you can face this way from me now. And now I'm going to be doing this, performing the same test again on the anterior side. Like before, just with every movement, just take a deep breath. All right, again. 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 All right, again. 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 Breathe in out for me. All right, breathe in out for me. All right, now for the axillary area. Breathe in, breathe out for me. All right. Breathe in, breathe out for me. All right. Again, based off of that, there weren't any wheezing, rhonchi noises, and then all his lung sounds are pretty clear. Now I'm going to be doing pretty much the abdominal assessment, so you can lean towards this way now. All right, based off inspection, I note that you can step up this way. Based off inspection, I know that his abdominal is pretty clear. His skin is aligned with the rest of his body. But his umbilicus, I note that it's pretty aligned with his umbilicus area. He has a small dip in his abdomen right here, which is an expected finding. Right now, I meant to ask you, are you having any pain in your abdominal area today?
No.
Okay, let's move these out the way. Okay, good. So right now, what I'm gonna be doing is I'm gonna be listening to his abdominal listen to his abdominal region. So I'm gonna start in the right lower quadrant, and I'm gonna be listening for a minute on each side for his vowel sounds. You have to breathe in, breathe out. Okay. So after listening to his vowel sounds, I noted that he had 10 vowel sounds with a minute, so which means that it's active. Now do I have permission to palpate?
Yes.
Okay. You feel any pain or tenderness in the areas?
Mm-mm.
Okay, I know that there isn't any distension, so that's good. So I noticed that there's not any distension, that's good. He had no pain or tenderness in those areas. And then finally, I'm performing a blunt percussion of the kidneys test, so you can pretty much sit up again like how you were before. And what I'm going to be doing now is I'm going to kind of just place my hand like this, and I'm just kind of going to beat like this. Do you feel any pain or tenderness in those areas?
No.
Okay, again. Any pain or tenderness?
No.
Okay. One thing I forgot to do was test your lung expansion.
Mm-hmm.
So what I'm gonna be doing now is you do me a favor, breathe in, breathe out for me. Okay, good. So what I noted from that is, based off his chest, his lung expansion, they were both symmetrical, which is good, and that's an expected finding. So that's pretty much all this for the video.